Let's talk about this amazing herb. Called ashwagandha. I want to talk about the dosage, when they take it, when not to take it. There's certain precautions, but also some benefits that you probably have never heard before. This is an amazing herb. Ashwagandha comes from the derivation of a Hindi name Ashan, which refers to H's odor as in H's urine. Apparently this herb does have a scent of his urine, but that being said, this herb is quite magical what it does. So let's dive right in as far as the amounts that are recommended based on a randomized control trials. You'd want to consume between 250 milligrams to 500 milligrams twice per day. If you're doing a tincture, like a 1:5 ratio, it's recommended that you take between 2 and 4 milliliters. That's roughly between 40 and 80 drops 3 times a day. Now, personally, I don't like the drops in alcohol because I just don't like alcohol, so I like the capsules, but a lot of people like the tinctures, and it seems to work just fine. Now, the most profound effect that this herb has on people is if you feel nervous, this is the best herb to take. Ashwagandha is an adaptogen. Okay, now, what is an adaptogen? A safe substance that helps you adapt to stress states. Adaptogens help you resist stress, tolerate and cope with stress better, and also help bring the body back to a normal state. Apparently, it's really good for any problems related to the autonomic nervous system, because the sympathetic nervous system is the system that adapts the body to stress, and then the parasympathetic, which is the other branch of the autonomic nervous system, helps recover the person from going through stress. So apparently this herb helps both parts of that puzzle, and since we're talking about stress, there's two main mechanisms that the body uses to deal with stress. One is through the hypothalamus pituitary adrenal axis. Okay, and that mainly has to do with the hormone aspects of stress, specifically cortisol, which is released by the outer part of the adrenal glands called the cortex, whereas the other mechanism, which is also controlled by the hypothalamus, okay, has mainly to do with the inner part of the adrenal gland called the medulla, and specifically adrenaline. Okay, so we have cortisol and adrenaline. Adrenaline is a neurotransmitter, cortisol is a hormone. Both of these systems are involved with stress, and ashwag can help both mechanisms. So ashwagandha has been known to significantly lower cortisol, which is very cool, which is going to then help you potentially lose weight as well, and improve insulin resistance, because too much cortisol can cause insulin resistance, and that can create all sorts of problems, from a metabolic syndrome issue which affects your lipids to blood sugar to a fatty liver to being a pre-diabetic, and also cortisol is involved with a stress-induced insomnia, not to mention adrenaline is also involved. So this herb can help you sleep better, especially if the cause of that sleep problem occurred from stress. And because the lowering of cortisol is occurring, you're going to feel calmer. You're going to have less anxiety, you'll have better brain function, less brain fog, and overall better cognitive function. Ashwagandha has been known to improve stamina, which is endurance, strength, while exercising. It's a good anti-inflammatory. It's also been known to help stimulate the thyroid, so it's really good for hypothyroid type situations, but not necessarily if you have a hyperthyroid, which we'll get to in a bit. And because ashwagandha helps regulate cortisol, it's going to help your immune system. Anything related to dysregulation with cortisol is going to affect your immune system. Ashwagandha has also been known to improve male hormones, specifically testosterone, which Can improve sex drive, also sperm count, as well as sperm mobility, so it's involved with improving male fertility. Ashwagandha is also good for pain, helping people with low back pain, improving a spasm, muscle spasm, and it's good for fluid retention. Now at the cellular level, ashwagandha can help increase something called heat shock proteins, which is involved in the hermetic effect, which basically has to do with getting the benefits from a moderate intermittent stress, causing the body to adapt and become stronger. So those are some really cool effects that can occur when you take ashwagandha. Now when wouldn't you want to take asham if you have a sensitivity to the nightshades? Okay, you probably don't want to take it. Ashwagandha is high in iron, so if you have a genetic problem where you accumulate innate iron and you can't get rid of it easily, ashwagandha is not good for you. Ashwagandha is good if someone is iron deficient because it's loaded with iron, but you don't want to take it if you have too much iron. And like I mentioned before, ashwagandha is good for hypothyroid situations, but not a hyperthyroid situation. And so if your thyroid gland is working too much, as in you have Graves' disease, don't take ashwagandha. Ashwagandha also enhances the effect of barb and the thyroid hormone, so if you're taking those two medications, you might not want to take ashwagandha. Now, as far as pregnancy goes, there's some interesting data on this. It's been used in India for a long time, even with women that are pregnant. It's been used like as a tonic, and sometimes they put it in milk. However, there are no safety studies that look at pregnant women taking this herb. There's some animal studies that shows that taking large amounts does not have a bad effect, but there is no studies with humans now because of the censoring and the suppressing of the algorithms on YouTube. It's becoming more difficult to find my content, and there's a lot of content that I cannot put on YouTube, unfortunately. So to make sure you have full access of all my information, go to drberg.com and